All right, thanks for joining us on KOIN Combos. This is James Shippey, breaking news anchor for KOIN 6 and Portland CW. I'm very excited for this next guest we have today. This is Dr. Gina Guillaume. She's an author of a book called Prescriptions and Prayers, where you blend faith and medicine together. It's an interesting read. How you doing this morning, Gina?
I'm doing well, trying to stay warm in this part of the weather this morning, but I'm very excited to be here, James. Thanks for having me.
Yes, thanks for joining me. And we met a few months ago. I was looking at the schedule, and basically it was like right after the summertime in September during your book launch. You came on AM Extra, and you had a lot of great things to say during the interview. And we
Yes.
have a mutual connection, Keith Sconyers, who I just interviewed. His interview aired a few weeks ago, so it's really great to have you on.
Likewise, thank you so much. It's great to be back, and I appreciate talking with you.
Definitely. So you got your book, and this is at the beginning of the year. We had Keith on, and we were talking about kind of the mindset, like a positive mindset to try and achieve goals, and it's really big into mental health. And I think your book is very interesting because you obviously talk about medicine, but also faith, which is kind of
Yeah.
a thing that's it's not as science based, so to speak, but. What made you want to marry the both of these subjects together and write a book like this?
Yeah, that's such a great question. I believe that it was perfect timing. To be honest, the more I speak with my patients in the exam room, I realize that there is so much more than what we could discuss in that 15 to 20-minute encounter. And additionally, you see the rise of burnout after COVID coming from a pandemic and going through some personal, challenges as well, being a Black woman who practices medicine in the state of Oregon. I would say that it was a perfect time for me to focus on how best to really help people get back to nurturing their soul. And you're right, it's not necessarily a conversation we always have in a scientific medical room, but I have seen the impacts of toxic stress, adverse childhood experiences on my patients, which leads to a lot of the conditions that I end up treating, such as high blood pressure, diabetes, mental health conditions. So I did think that this was prime time as I went through my own healing and personal growth journey to share and talk about my personal lived experiences and also my professional experiences to bring people to a place where they may not know where to begin to talk about that conversation about healing, addressing things from childhood and focusing on nurturing that soul.
Well, this is interesting, Dr. Guillaume, because yeah, a lot of times with medicine, what is it? I don't know if the phrasing is right about treating the cause more than a symptom, right? Like, so a lot of folks, you get on
Right. The
medicine, for
symptom more
instance,
than the
right?
cause.
Yeah, exactly. So,
Mhm.
but kind of a thing that's become more popular recently, and maybe even more so than recently, but in the sense of like, hey, instead of just taking certain medicines, what are you doing with your diet, right?
Yeah.
Or how
Yeah.
stress can affect your health.
Absolutely.
And that's the thing I remember hearing growing up very early. That concept from my own father would talk about that kind of stuff.
Mhm.
Um, have you seen, because how do you bring this to the the emergency room or to the doctor's office? Because like I said, you normally have folks come visit you. They're like, okay, I've got a problem here and here.
Yeah.
How do you solve
Yeah.
that? How do you try and incorporate that? Whether someone may have like that spiritual side or not, like how can you kind of incorporate that for your patients?
Yeah, that's such a great question. So thankfully, I am a family medicine doctor. So I see patients in an outpatient setting and I build relationships with my patients. So typically, it's not like the emergency room where you treat somebody in an acute setting and you don't see them again. So I continue to see my patients, which is a very great foundation because I get to know people as I walk through that journey with them. But essentially, when I do treat my patients, I approach it holistically, where I am asking not just about past history, past surgery, allergies, and medications, but I also want to know about what runs in the family and I want to know about lifestyle. So I ask questions such as, hey, how do you exercise, right? Do you belong to a faith community or a spiritual practice? That's important to me. How do you feel? How are we feeling today? So thankfully, we also have questionnaires that could screen for depression and anxiety. I do ask about substance use, right, and smoking. So during that holistic experience, I get a chance to assess what comes up and how I can best address it. And depending on what comes up, I get to share and guide people and point them to also where stress might be playing a big role.
And see, that's so great because, as you say, as a family doctor, I think about when I go to the doctor myself, establishing rapport. We don't just talk about, what I'm there for. It might be like, well, how's your day going, or what's going on with the little one, or especially
Yeah,
the pediatrician.
yeah,
It's not just okay, diagnose, get me in and out, write a prescription. It's really talking about stuff and kind of working together of a holistic plan, which I think is really
absolutely.
good. Um, when you're in, I guess, medical school and things like that, because I remember once, back in my in my acting days, I did one of those kind of like mock trial situations, like where we would talk to med students and they come in and try and, we're a patient and they're supposed to deal with us. And it's fascinating seeing different med students, like how they interact with the patient. Some a little bit more warm, some maybe not as much, but it could be a personality thing. In med school, how much do they talk about this, about developing rapport with your patient? Is that really paid close attention to?
I would say it is. Thankfully, I attended a historically Black college and university for medical school. I'm a graduate of Howard University.
Okay, all
And
right, Howard. Howard in the
yeah,
house.
you know. What I would say is having that experience with a lot of my attending physicians being Black and being surrounded by a lot of other people who look like me in general, I think by default, we got a lot of that cultural experience. So maybe I was spoiled in that way. But training wise, we did have simulations that you discussed where we would have those mock encounters with our patients. And it was during that time where we were able to develop some of those cultural experiences and get feedback from our preceptors. Now, whether that is standard at other medical schools, and that I cannot speak to. And I believe that that is something that does interfere sometimes when we are meeting other patients of different cultural backgrounds. And also given our current, political climate where a lot of DEI work is being dismantled from a federal level, I could see how people probably aren't paying as much attention to that, though it is very necessary and helpful for patient outcomes and to just treat people with compassion.
That's great. And it's like I say, you talk about how it may differ at different universities, right? So at HBCU, like the historically known Howard University, it might be different there than maybe at another school. Um, how has your background played a factor in that? I mean, because like I said, we all bring our own lived experiences to what we do. My stepmom, for instance, is a psychologist, a doctorate in that. But she grew up in the church. She's from Mississippi. She's lived around the country, but she grew up with this kind of very strong Southern background, in Mississippi, and she kind of brings maybe some of her faith, whether or not she talks about that with her clients, but she has that in her when she's interacting with folks, trying to help them deal with their trauma.
Yeah. James, how much time do we have?
I know.
I'll play it. I'll play it. I'll try
No,
to
I
be.
know. I totally get it. Yeah.
But that's such a great question because of my background. And that's why I wrote the book. Because I am a first generation college student, college graduate, medical doctor in my family, I understand that context. And I would love to see other minority students who are gifted and talented pursue their dreams, no matter what the noise is around them. So I was raised in the Bahamas in a town called Jonestown, 8 Mile Rock. in Grand Bahama, and I was born to Haitian parents. So I was a minority student, and God opened up opportunities for me to pursue higher education. And eventually, I got into medicine, and I knew that this is something that I wanted to do and to really help to reduce a lot of the diseases that I saw growing up with around me and learning that they were preventable and treatable. So I want to fast forward. I came to Portland as the first Black medical director of North by Northeast Community Health Center. And it is a clinic that services a large Black population. And that aligns so much with the work that, mission that I do and what I want to do in terms of serving people who look like me and who also just didn't get that chance to really get access to quality care for many different reasons. So I'm also community health trained. So what I do now is I go into communities too to do a lot of health talks and health workshops, um, really to reduce these disparities that we see where many underserved minority patients aren't necessarily getting the best healthcare that they deserve, that they need for various reasons. Like I said, we may not have time to dive into what those look like. And I also see the underrepresentation of minority students in medicine, and studies have shown that once that is there, that race concordance, that the outcomes, satisfactions of patients are increased. So there's benefits of having that as well, more representation in medicine. And where the faith-based component comes in, because the book is entitled Prescriptions and Prayers, Healing from Childhood Trauma and Guidance for First Generation Minority Medical Students. I think a lot of people in the faith community may not realize how much more the soul needs attention just as much as like the physical. So I do want to give that aspect just to point people back to we really do need to heal and address a lot of those root causes of toxic stress in order to even show up in a healthy way.
That makes sense, definitely. And I think I may have asked you this before, but just to even go deeper on it, once again, because you may have some folks watching this, and there may be some people that may not be spiritual or religious. And how do you deal with that as far as people that may be skeptical about or worry, like when you talk about faith like this, are you replacing the science? Or, okay, you're talking about that, but your lane is to treat my symptom, and if I want to do the other faith stuff, or I'll do the church or anything with mental health, I'll go see my therapist if I
Yeah,
have a
yeah.
therapist.
Yeah, absolutely. And I get that. And I get that. What my response would be is that they don't have to be exclusive. I do think that there's room where they could intersect. And if someone is not practicing a faith, that's okay. Like, I'm still here to address the symptom and the concern that's within, my Hippocratic oath to do so. We're on the same page. You're still gonna get your medicine. However, it is well known that certain conditions we don't have treatment for, and we don't always have a solution. And in some cases, people do have testimonies of miracles where there was a faith component that helped them to overcome what they were going through. So I think it's beauty in having that tapestry of those options and having a provider that can discuss those things for those who do have that interest. And I believe that mental health care is part of a person's overall health. So I appreciate where I work now. I actually do work with Cascadia here in Portland, Oregon. It's an integrated behavioral health care. So not only do we provide primary care treatment for a lot of acute and chronic diseases, and I perform a lot of procedures, I'm very well trained medically, but we also do a holistic approach. If somebody is coming in with some stress or anxiety, postpartum, depression, etc., there are options. There are therapists, there are psychiatrists. So it's integrated within the system. And I do believe that that just overall bolsters and makes that healthcare even more appreciated and a better outcome for my patients.
We're going to take a quick break, Dr. Guillaume, and then we're going to talk about your book release. I got some footage from there and everything, talk about that. And then, of course, just go deeper into prescriptions and prayers and your background and how you're trying to help patients, not only the ones you see, but with a book now, like anyone around the world, really.
Yeah, thank you.
All right.
I've been living in Portland, Oregon now for almost 5 years. So it's helpful to go into the community, go to events, connect with people. We are not meant to be isolated. So I do feel like even, you spoke about the co-host, right? Keith Scanias, and I know you interviewed him earlier in the year. But we had a dynamic conversation and I appreciated that level of support. And that's the foundation of my book in terms of getting people to understand how important community is and how important it is to see people who look like you succeed. So I believe that this book really does help those who might be struggling and not sure about pursuing their dreams for good reasons, whether that be trauma, whether that be poverty, whether that be discrimination or self-doubt, right? I think this book addresses that, and I don't mind being the guinea pig and sharing some of those scars, right? Because it is helpful, I know I have a lot of accomplishments as we, can clearly see, but that didn't come without scars and also without facing a lot of hard truths and a lot of hard traumatic experiences, even from childhood. So I think it gives people permission to walk through something and those things that might be barriers to how they show up now, even in their adulthood. So I think all of that is necessary. And I even have a companion journal to the book for those who also want to do some like deeper processing as well.
Actually, that's a great thing to hear because I think sometimes when people read books, unless they kind of are, they're self reliant enough to be. Normally you got the dog ears in the book, so you're highlighting passages. But, sometimes once you're done with that book, you're done with it. Maybe you come back to it every once in a while. But to have a companion journaling piece, which is, I think that's kind of a practical way to kind of keep the momentum of what you learn in your book. In the grand scheme, what do you want folks to take away from your book? And without getting completely into it,
Yeah,
like, is
yeah,
there even like something I would say actionable that someone could be watching
yeah.
in this interview and say, okay, well, where do I start as far as like implementing faith in medicine, or do I take this energy into my
Yeah.
own doctor, or maybe even see Dr. Guillaume? Look for you.
We're
you
we're
know,
accepting new patients. Cascadia, shameless ad.
right?
Cascadia is accepting new patients. So please, I'm very proud to be a clinician at that health center, and I respect my fellow colleagues so much. So I do think Cascadia hires a lot of brilliant community, compassionate, care-oriented physicians. I just want to say that out loud.
Definitely, definitely. So, all right. Um, what
You were
would you say?
asking me, yeah, you
Yes,
were
yes.
asking me
What were?
my like takeaway and actionable. I know, I
Yes.
just like just gave you an from my workplace.
No, no, there's nothing odd about that because, like I say, it's self promotion, which you've learned from doing this book. So obviously, you got to self promote. We're always
Yeah,
promoting. In
yeah,
life, we're always either buying or selling. That's really what it is. So,
yes,
yeah.
yes. I hope my book gives people permission to address when they're not okay. I think that, sometimes we think that we always have to be strong, we always have to have things together, but we do, as humans, have these moments where we're just simply not okay. As you read the book, I hope that somebody who's not okay would pick up the pieces per se and keep going. As I mentioned in very concrete examples of what that looked like for me. So resilience is what I'm hoping that somebody would take away from the book. And given where we are in 2026, resilience is going to be necessary. It's just too many things happening at work, at home, and financially, economically, federally, socially. I think that I want to remind people that resiliently made, and we can keep going no matter what happened to us. Somebody, I don't know who said this quote, but they said that, a lot, it's not what's wrong with us, but a lot has happened to us. And I like that approach because though things might have happened to us that are not our fault, but it is our responsibility to heal from it. And I do want to start that conversation or keep that conversation going through this book, through this journal, that it is people's responsibility to take up that healing process.
That brings up a great point as we're closing, Dr. Guillaume, because, in the environment we're in, a lot of folks are stressed out, whether it's
With reason.
yeah, for a reason. Yeah, a lot of people's going through something right now. Whether it's financially, they're looking at all the stuff they're seeing on television with all the political stuff, things going on out there in the world, and just a lot of uncertainty. And those
Yeah.
things can affect stress levels, and stress
Yeah.
levels obviously can affect our health.
Yeah.
So I think it is important, and I couldn't agree more that it's important for people to
Yeah.
take care of themselves and get educated, because there's so much information out there right now to make sure you take care of the body and not wait until something goes wrong. Check in with yourself, because mental health is just as vital as or it's interconnected, as you would say.
Absolutely. And this is where, at a time like this, I think all of our tools should come in. We need that. We need support. We need the community, positive, supportive people around us, right? Like we do need, good food. We do need exercise. We need to go outside, right? Like we need sunshine. We need to connect with nature. We do need, mental health care. That's important. Processing, journaling, like all of those tools need to come together in addition to seeing your primary care doctor and going to get a checkup and letting your doctor look at your blood pressure
Oh yeah,
and make
gotta get that
sure,
blood pressure.
at least once a year, I'll say that. But it's not just that. I do think all of those tools need to come together at a time like this. We just cannot be negligent with any of those resources at this point in time.
That's a great way to end this. And I like I said, once again, it's very, very true. Take care of the whole body, the whole person. Take care of yourself so you can take care of others, especially for parents out there or anyone. You don't even have to be a parent, but you got to take care of yourself first. And that's in so many ways.
Yeah.
Dr. Guillaume, where can folks find your awesome book, once again, on prescriptions and prayers? Where can folks find this?
It's available mainly on Amazon right now. So you can go there, Prescriptions and Prayers, Healing from Childhood Trauma and Guidance for First Generation Minority Medical Students. I also have an Audible. So for those who are more auditory listeners, you can also download that from Audible. My website also has a link to resources as well. It's myname.com, ginaguillaume.com, and you could also follow those links as well. And thank you in advance for supporting.
Definitely. Well, Dr. Guillaume, it's been a real pleasure speaking with you today, and I think this is definitely some useful information, and definitely recommend folks go out and get that book. Take care
Thank
of that
you.
whole body. Faith and
Thank you.
healing and medicine all together. So thanks again.
Thank you. I appreciate you having me. This was amazing, James. Thank you.
Thanks.